The History of Benjamin Rush.
Benjamin Rush pursued an early education in Nottingham, Maryland. For 5 years, he learned Greek, Latin, English, mathematics, and other classical subjects under his headmaster, Dr. Finley. By the age of 13, he had finished his preparatory classes and entered the College of Princeton in New Jersey. Before he turned 15, he had completed all the requirements for his bachelor's degree and graduated in 1760. He then returned to Philly in 1761 and joined Dr. John Redmond, serving a 5-year apprenticeship. His apprenticeship included duties as a nurse, coachman, and prescription clerk. He assisted the doctors in minor surgeries and learned his medical skills through experience. His training in Philly was the opportunity to be around some of the very best medical teaching available in the college.
Dr. Rush was famous for his technique of bloodletting. Bloodletting is when small quantities of blood is withdrawn from a patient to help cure or try and prevent an illness or disease. This comes from an ancient system of medicine where blood and other bodily fluids were very influential to human health. This is the most common procedure done by doctors up to the late 19th century, almost 2,000 years. Bloodletting isn't used anymore for very many conditions except a few. It is thought that bloodletting could have been used to temporarily reduce blood pressure to help treat hypertension by reducing the volume of the blood. Even though bloodletting was used to help treat and prevent symptoms of certain illnesses, it is concluded that the excessive use of bloodletting was harmful to the patients that were given this treatment.
Benjamin Rush was highly regarded for his work during the 1793 epidemic of yellow fever. Yellow fever is a viral infection transmitted by mosquitoes. The first major spread of yellow fever epidemic was in Philadelphia in July 1793. The epidemic depopulated Philadelphia. 5,000 out of the 45,000 people occupying Philadelphia died, and it's estimated that 17,000 people fled. Rush believed that the outbreak of yellow fever had developed from a pile of rotting coffee beans left on the docks. He developed an aggressive approach to treatment by bleeding his patients and administering large quantities of mercury.
Pennsylvania Hospital is the nation's first hospital and was founded in 1751 by Benjamin Franklin and Dr. Thomas Bond. Although he worked at Pennsylvania Hospital, Dr. Benjamin Rush could not treat his patients at the facility. His bloodletting techniques were not needed at the hospital because they didn't admit people with infectious diseases. The hospital is famous for its unique structure. The first floor of the center building features the Great Court, an antique fire pump, a Thomas Sully portrait of former board president Samuel Coates, and the president's office. The second floor of the center building houses a historic library. If you follow the large double staircases up to the surgical amphitheater, you'll see that under a skylit room, surrounded by rows of medical students above, surgical procedures were performed from 1804 to 1868. Today, the 534-bed acute care facility offers a full range of diagnostic and therapeutical medical services and is a major teaching and clinical research institution.